But you do see, like, we did that issue tonight about the PPP program, $800 billion.
It's outrageous.
I know, but do you understand why people who pay a lot of, because the rich do pay the most taxes. I mean, look, I'm not saying that's not right. Of course, the rich should pay the most taxes. But do you understand why people go like, I'm giving up all this money. I mean, I don't remember the last year I paid less than half. I pay more than half. I'm not I'm not Amazon with an army of lawyers. I'm just one guy. HCO is very generous, but the government, I'm in the 39% federal. California takes 13. That's over half. You take over half and you still have everything fucked up? You understand why people are like, well, I would give it, except you will fuck it up.
In this exchange between Bill Maher and Ramaswamy, we dive into some of the biggest issues facing America today: the economy, healthcare, and the ever-present tension between the elite and everyday Americans. Maher comes out swinging with critiques of government's mismanagement of funds, while Ramaswamy hits back on capitalism and the way it's supposed to function in a truly free market. This is an intense debate you don't want to miss, so let's break it down.
Oh, you really think that most people...
Well, I'm just saying, I mean, we did the issue. $800 billion, and only a quarter of it went where it should.
So, look, I don't think capitalism is a perfect system, but I think it is the least imperfect system of allocating capital, because when you leave it to the government, it actually hurts the very people who it is supposed to help in the first place. You actually saw billionaires print much more money over the course of the pandemic precisely because of these government policies that then fed a stock market that became addicted to loose monetary policy and loose fiscal policy that, guess what, makes stocks go up. And who owns stocks? Rich people. Okay. So no surprise that there's a populist outrage both on the right and the left. But we need to find a different way of ultimately separating politics from letting free market capitalism be free market capitalism. If some guy ends up with more green pieces of paper than the other, so be it, as long as we're all equal in a democratic system of governance. That's what I think we need to go to.
I feel like this table is a bunch of French aristocrats a week before the masses made it to the Bastille. This is not about what you think. It's not about what you think, because you are, listen, I'm very glad free market capitalism has been wonderful to you. It hasn't been bad to me. I understand the high side of this party. If you're in the party, it's wonderful. Not enough people can get into the party today.
We're saying the same thing, Marianne. We're saying the same thing. They're locked out by government policy that actually favors the people who are in charge, like the stimulus program.
Again, with the PPP thing. It's not that I'll give you half, but then what are you doing with it? You're not giving to the people I want it to go to. You're giving it back to these assholes buying jet skis. You know, it's like, that's what
most of the people who do not want to pay higher taxes, who have a lot of money, are not complaining about where the PPP loans went. They, as Martin Luther King said, if they give it to poor people, they call it a handout. If they give it to rich people, they call it a subsidy.
But this didn't go to poor people. That's the whole point. It did not go to the poor people.
So but those same rich people are the ones who do not want to pay, for instance, something like... President Biden, if he wanted to, could declare a national medical emergency and expand Medicare to everyone tonight. If President Biden wanted to, he could cancel all the college
I'm glad you brought that up. This
tonight.
is the next question that we are sent in. Why isn't universal health care making any progress even in a liberal state like California?
The majority of people want it. And you said not because of the insurance companies? Okay. The majority of Americans want Medicare.
No, I didn't say that. I said not just because.
Okay, but that's what happened in California. It was that $1 million check from the insurance companies.
Well, it's also the pharmaceutical companies. The pharmaceutical companies make more than the insurance companies, a lot more. And their goal is not to make you healthy. It's to sell drugs.
Matrix.
I actually think there's truth to a lot of what you guys are saying, but at the end of the day, they're able to deflect accountability for these questions by actually changing the subject. That's a big part of what we were talking about with this cultural elitism, is ultimately part of the reason that you see Pfizer decide, or a big corporation decide, that there's going to be a certain number of people who are going to staff its ranks who are diverse. These are the press releases you see from pharmaceutical companies today, not actually how we're going to bring down the cost of drug development and make drugs cheaper.
Can I interject a little factual that I recall? I may not have the facts exactly right, but they have done this, they've studied this. Why can't we have universal? Because it is popular as an idea in California.
The majority of people want it in the United States.
Okay, but when they crunch the numbers here in California of what it would cost to have universal health care, it's like taxes would have to be like 80% for everybody or something.
There's a different way to do it.
Insanely, the numbers, and that's why they give up on it.
Universal healthcare sounds like a great idea on the surface. After all, who wouldn't want everyone to have access to affordable care? But let's not forget it is not free. Someone has to absorb the cost of the actual care provided, and access to care is already challenging, especially in specialty and subspecialty care areas. Before we implement a universal healthcare system, the U.S. healthcare system needs a major overhaul. Plus, the reality of implementing it, especially in a country as large and complex as the U.S., is much trickier than passing a law. And I know people also refer to like other countries, like, well, this country has universal healthcare, this country has universal healthcare. Yeah, that's great, but how they implemented it and how it works for them is not necessarily the same as how it will function in the U.S. Plus, there's also the issue of current healthcare systems efficiencies and the corporate interests that are deeply entrenched. The pharmaceutical companies, insurance giants, and other for-profit players have a significant hold on the healthcare system, making it harder to actually lower costs. So while the idea of universal healthcare might sound like a noble goal, the path to achieving it is filled with challenges. Without serious reforms and the removal from for-profit middlemen, we'll likely see the same inefficiencies and inflated costs under a new system. There might be a better way to get there, but it's definitely not as simple as just saying, let's just do it. Let's have universal healthcare. It's not that simple of a statement.
Well, there's
because
a really
the numbers
different way to do
just
it.
don't work.
There's a
because,
different way to do
again,
it,
the
though.
corruption in the system. Because
I agree with you. There's corruption in the system.
Again, the pill, the COVID pill that they're working on, I think it costs $17 to make, and it's going to sell for over $700. That's the problem. We can't tell the gougers to stop doing that.
There's a different way to get to universal health care, and I think it's really important because no one's talking about it, is actually you might take the administrative bureaucracy that's responsible for administering those dollars, just like the bureaucracy that administers PPP, by the way, they waste a lot of money, send it to the wrong places, and I would say, let's actually dissolve that entire apparatus, CMS, Center for Medicare and Medicaid Services, take the money and distribute it to the people who can't afford to buy private health insurance to actually buy private health insurance. And if you crunch those numbers, it's about $5,000 to $6,000 a person. It gets you most of the way there. So get rid of the bureaucracy and give the money back to the people. That's what I say.
What we need to remove is the profit-making middleman of insurance companies. That's what needs to be removed. You're still helping the insurance companies. You're still giving the money to the insurance companies.
Marianne, I think the last time I read about it, maybe the number is slightly different, I think that the profit of the health industry was something like $11 billion, right?
And?
Does that sound right?
I don't know, actually.
Okay. And our health care bill is like $2 trillion.
Yeah.
I'm just saying it's not all there.
It's not all there. That's exactly right, Bill.
I mean,
it's the same people giving out PPP that are allocating healthcare dollars. That's the problem.
It is. The insurance companies, yes, they did some terrible things, way than they used to 10 years ago. When Michael Moore made Sicko, they got away with whatever they wanted. And after that movie, things changed. But right now, we do not stop this gouging. We do not stop. I've read this. There's a hospital, like in one part of the city, that charges, $1,800 for a knee replacement. And a hospital 2 miles away, and it's $15,000. I mean, there's no rhyme or reason to what we've all been, or known someone been in the hospital, and you get the bill, and you're like, the slippers are $45?
It's the same reason dead people are getting PPP checks. The government can't do it.
And people go over to European countries where it's a fraction of all of that, where they do have socialized medical systems.
Okay, but what does that mean, socialized? How is that going to stop this? I mean, if it can, yes. If that's what is involved in socialized medicine, I'm all for it.
So what's going on in Europe, though, Marianne, is this is just an important issue to see for Americans, actually, to bring money back. And this is one of the things actually would give even the last administration a good amount of credit for at least spotting this issue. They're free riding on what happens in the United States. So I ran a biotech company. I can tell you any company that runs the numbers of whether a drug is worth developing looks to the United States first because they know the United States pays the highest price. If the United States paid the same price as Europe, that drug wouldn't have gotten developed. So what Europe figured out is actually the drug is going to get developed anyway, and once the company's already gotten it to market, they're going to give it to us anyhow so we can get it cheaper. So that's actually what you're seeing there is gamesmanship on the part of Europe, free-riding the innovation in the United States. That's a complicated issue. But I think the right answer is get rid of the bureaucracy.
And I'm not arguing with you about how fucked up our system is. One reason why we went through this nightmare with COVID is because hospitals are run like airlines. Airlines want to sell every seat, Hospitals want every bed filled. That's why, oh my God, the hospitals are overrun. Yes, because you don't want to have any empty beds lying around.
They want them to be overrun.
Not overrun, but they want to be at
full
capacity because that's good for the profit. Hospitals themselves shouldn't be a profit thing.
That's the point.
Yes, I understand
Thank you, Bill. None of it should be about profit.
Another thing that's really fucked up about the system is actually the number of COVID case counts or deaths due to COVID are overcounted.
Yes.
Because if somebody shows up for a different cause, let's say they're hit by a car, but they ultimately actually happen to test positive for COVID, they actually get higher billing rates in return for actually counting that person as positive for COVID, which just tells you that people in a system, whether or not we like it, respond to incentives. We have to take that into account when we set up the system. That's what I say.
All right.
At the end of the day, whether you're siding with Maher or Ramaswamy, it's clear that both sides are pointing to some major flaws in the system. Bill's right, government programs often waste money, but Ramaswamy's got a point too about the crony capitalism that benefits the wealthy at everyone's expense. So where does that leave us? Thanks for watching. If you enjoyed this, make sure to like, comment, and subscribe for more bold and unapologetic content.